And ready? Ooh, did you hear that?
That was
actually
good.
loud. Good. Got it.
It's okay.
That was the worst one of all.
Oof.
Wow.
Good.
All right. So we did a photo shoot once with the 4 dogs. It's on one of my sites, and it's like the masthead. So I'm thinking we could do it again. But we're trying to get all 4 dogs ready, then we're gonna jump in. All right, so here we are. We got 4 dogs and 2 humans. This might be the only video on YouTube that has 4 dogs and 2 humans getting adjusted at the same video. And if I'm wrong, send me the video. I want to see it because I think this is going to be the only one. It was hard enough just to get the 4 dogs on the table. But let's get started, okay? I mean, this is it. I've actually met these dogs before, and also the owners. So this is Emily, this is Regina, this is Z, this is Critter, and this is Doc, same name as me, and this is BB. So they're all friends, and we're gonna have some fun today. But let's check Critter first, okay? So where's that rib thing that you're talking about?
All right. Hold on. You hold him for a sec.
Okay.
Thanks, Doc.
She's bossing me
right
around.
Right here.
Okay. Yeah, so this is, it's not really an anomaly, it's kind of an injury. So probably happens. Do you know how old Critter is?
He's 1.5 years.
Yeah, so it happened at some point. Could have happened when he was a puppy. He could have, like, you know, puppies squiggle and get dropped and stuff like that.
Yeah.
And it probably popped that little rib out, and now it calcified. So you can't adjust those type of things because they're already rock solid. And what I'm feeling is like a knuckle coming out of his rib. It's not a knuckle, it's his rib. And it's perfectly normal, and I find them a lot on dogs. So that's what that's about, now you know. I mean, if cosmetically you want to get that work done, you should go to a medical destination like, I don't know, where do you want to go? Colombia? All right, so let's go. We're gonna check you. May I work with you, Critter? Is it okay if I give you a treatment? What do you think? Is that okay? All right, and you're just chomping away. What do you have to say about everything? Is it okay if we work? Look, I'm gonna check your extension. Nice extension. Look at you showing off. We're gonna check lateral flexion, a little bit here. There it goes.
Good boy.
There you go. Now I'm gonna check your little legs. I mean, this dog's in good shape, like really good muscular body, and checking the neck muscles, checking here. Still got a little bit, no. Oh, there it goes. You hear it click a little bit?
Yeah, Critter.
Good, let's check your little jaw, check your eyebrows, and now we're gonna check your little, so you hold on to him so he doesn't jump. And check your little feet.
You're okay.
And let me check your other foot.
You're okay, dude.
All right, good. And now we're coming down the back. So dogs have 7 bones in their neck, 13 thoracics, and then 7 lumbars. So we're gonna go into the 13 thoracics next, and just checking each little segment one at a time. Here's 10, 11, 12, and 13 feel pretty good. 13 is a little tight, so let's do that one. There it goes. Did you hear that?
Yeah.
Yeah. So here's the first lumbar, L1, 2, 3, 4, 5, 6, 7. A little bit 7.
Good job.
There goes 7. Here's the sacrum. And coming back through, let's check the little extension on the legs. So we're going to check your little leg extension. Feels nice. Let's do the other side. So you hold on to his upper chest. So you let his feet touch the ground, but just make sure he doesn't fall. Okay. Good. And let's check your tail. And let me go back on the rib and see if there is any movement there. No, this is fused.
Yeah.
So it's calcified, it's hardened. It's like a really knobby rib sticking out. No, that's good. We just check rib cage symmetry. There it goes. All right, let's put him on the ground, see if he shakes out. Ready? Shake on cue. Wait, just don't touch him. Don't touch him so he has a chance. There's the shake.
Good boy,
Good.
Critter.
All right, who's going to go next? Maybe BB. Look who's behind you. Okay, BB's like, what about me? And my question is, do you have your insurance card with you? BB, why are you taking life so seriously? This is just a fun video of 4 dogs and 2 women getting adjusted. And what are you thinking about? What do you think? Should we do an adjustment?
Yes.
Can I have a little check?
Oh yeah.
Thank you.
Yeah.
Can we do an adjustment?
Says for sure.
Okay, we'll just check you, okay?
She is epileptic 1.
Okay.
And then I do think her shoulders seem a little bit off.
All right.
Gait, but we'll see.
All right, so we're doing things differently today, you know?
Good girl.
Bibi, can I work with you today? Would that be okay if I work with you? Think about it. You don't have to respond yet. You can think about it, mull it over a little bit. Have a talk with her.
You good, Mama? She's good.
All right. Yeah? Just gonna massage right here.
She's falling asleep.
Me too. All right, so I'm working on her upper cervicals. I'm checking out where the occiput meets the atlas. Now, especially quadrupeds have very large transverse processes. We call them the wings of the atlas. Humans have little nubs. We don't get that same lateral like handles, but you can feel it on them. They got like this real place you can hook your fingers around.
Yeah, she loves it.
Yeah, and so I'm working on that right now and massaging the posterior little muscles between the occiput and the atlas, and just massaging behind the ears. And I just think I love this dog. You're so fun.
Isn't she the best?
She's really cool. Okay, let me check you this way. Let me check you this way. Let's bring her head around. No problem. Let's bring it up. Hello, what are you thinking? Look at you. Nose to nose. Wow.
Aww.
A little bit in here. Okay, I'm going to go into your C5 and adjust this. Is that okay? All right. Ooh.
Yeah. She needs it.
That was a good one.
That was a really good one.
By the way, that helps the front limbs too. So I'm going to pick this leg up. Listen to this. Oh, there it goes.
Good girl.
Okay, let's do this one.
So straight.
Okay, I'm going to pick up this leg.
Such a good dog.
Take a breath in. There it goes.
Good, Mama.
Good. Nice and good. Check each little finger. Ooh, it cracked. Let's check this one now. So just hold her chest, so
Yeah.
just make sure she doesn't
She's
fall.
just flopping because she loves it so much.
Yeah. Good. So I'm just working each little joint.
Good.
High five. High five. Oh, move that shoulder, move the shoulder, rub the shoulder like that. Mobilize it, take it in, take it out, take it in, take it out, take it in, take it out, take it in, take it out. Let's do this side. Take it out, take it in, take it out, take it in, take it out, take it out, take it out, take it in. Okay, now we're going to move down the back. Okay, we're going to do a little bit more.
She's ready. Sorry.
Okay, so here's the withers area, T3 through T8. I don't know if I've ever adjusted a dog that sits up this tall. It's like you're almost like a human.
She is very human-like. Or statue-like.
Take a breath in.
Good girl, Mama.
And there it goes.
Good girl,
Ooh, I got it. All right, so now we're going to have you stand this way. You control the front.
Yep.
And I'm going to put my arm under here and bring up this back leg into like a little doggy arabesque. Let's bring the leg forward. Ooh, yes, yes, right in there.
No.
All
your
a
friends
little
are
tight
watching.
there.
Mm?
A little tight in
Okay.
extension, but we're just loosening it up. Got the hip going. Nice hamstrings, nice quads.
Yeah, sometimes she just reminds me of a creaking rocking horse, you know? And she needs to be loosened up.
All right, we're definitely doing that today.
Yeah.
Going her back to her non-creaking rocking horse.
Yeah. Smooth sailing.
Right there. And ready? Ooh, did you hear that?
That was
actually
good.
loud.
That was good.
So that's good, because
Easy.
that's in your thoracolumbar junction. Are you listening? Because I'm explaining this to you. And yeah, that was your thoracolumbar junction. And what's good about that is that's that transition area where a lot of dogs can get arthritis as they get older. So I'm keeping that open for you so it doesn't creak anymore, okay? All right, we're all done. Do you want to just sit and watch everybody else get worked on, or you want to hit the ground? We'll see what happens. See if she wants to sit first.
It's all good. You do you. Good girl.
All right, who's next? All right, so next we have Doc, DOC, right?
DOC?
Just like Doc. So can I work with you today, Doc?
I would love that.
Did he say that? All right, let's work with Doc today. Is that okay?
Oh, yeah.
Is that okay? All right, let's get started. So we're gonna tilt his head up. And it's a little, I'd really bring it up a little higher, Doc.
You're okay, Bo. Just relax, okay?
That should come higher, Doc. All right, maybe it's a little misaligned. All right, so take a breath in, Doc. Okay. One more time. Breathe, Doc. All right, and we're going to release it as you come up. There it goes. Good. Now watch the difference.
Good boy.
Big difference, right?
You almost a gymnast.
That's like Cirque du Soleil neck. And we're going to come into lower cervicals next because there's still a little down here. Ooh.
Good boy.
Good. So now I'm going to keep going a little bit at C5. There it goes. Coming down the back now. Okay, so now we're into the thoracic area. And so Doc is, you know, that he's not old yet, but he's not a puppy anymore, so he's in those kind of middle years. And I'm checking here specifically. Let me put my leg under there. And
Nice.
there it goes. He's letting me have all this.
Yeah, he's a good patient.
So let me get on those tubersacralis, come in between. Got it.
It's okay, Boo.
That was the worst one of all.
It's okay, Boo.
Okay, that one scared him.
He's a good boy.
But that one was bad, so that's his bad spot.
It's okay.
That's probably all I need to do to finish up with him. His tail is normal. He's got that little fatty cyst on it, but that's normal. And let me just see your leg. I'm going to pull it up, check his little kneecap, bring him back into extension. Oh, crack those toes. Did you hear that?
Definitely
Really
good.
nice. Let me bring this leg up. Good. Kneecap okay. Sometimes dogs will get a misaligned kneecap. Check your rib cage. Let's go back and check the sacral base that I just adjusted. That one made him wince. No, it's fine now.
No pain, no gain.
Yeah, so
you know?
sometimes. There you go. Look at that. So nice. Right in there a little bit. Did you see him wince a little there?
Mm.
There it goes. Woohoo! I just got that one. All right, I think you were good, buddy. So you want to get down and shake your little head?
Good boy. Okay, hold on. You gonna wait until we leave?
It's okay, you don't have to shake.
He says thanks.
Sometimes they don't shake. All right, so we have one dog left. We have Z. Now, so Z had this weird moment at the park recently where he twisted and where she twisted and came up a little achy.
Like that, with like she jumped from a high spot and right away like she kind of like her neck was like that, but she wouldn't let me touch her, and then it was okay.
And then it went away.
Yeah.
Because a lot of dogs. And how old is Z? Do you think?
She's 4.
She's 4, so she's still young enough that she was able to walk it off and just correct it on her own, right? But we will look to see if there's any underlying misalignment that's still lingering, and even though it's not symptomatic anymore, we'll see if it's still there. I've worked with Z before, so this is my second time with Z. And this is Regina, and Z is the special dog. Z is the one that saved your life.
Yeah.
In a way.
She did, in a way. Very.
Because she was emaciated and, right? She had no body weight.
Yeah.
Tell us a little bit about that, because there's an interesting story.
She had.
She was infested with infection, right?
Yes, she had parvovirus, giardia, coccidia, and hookworms.
Parvovirus, hookworms, and giardia virus.
And coccidia. She was.
And she was almost dying.
She was dying.
She was dying.
Yeah, she wasn't eating at all. Or drinking spontaneously. Like I syringe fed her and gave her.
She's an expert nutritionist, so you basically, through nutrition and homeopathy
and herbs,
brought Z back. But it also was a breakthrough for you, right?
Yeah, because I wasn't. I was working with humans before, and then when I saw what I did for her, she basically whispered, "Now you have to do it for." And
she has. So she's now built up a practice of nutrition for animals, especially medically challenged ones, perhaps, right?
Yeah.
Yeah. And so what a great background. We're going to put your link so people can find you. So let's see. Can I work with you today? How do you feel about that?
She just feels hungry.
She's probably just focused on the food. But is it okay if we start?
Yeah, it's okay. Z is a little bit touch shy, so...
So I'll work fast, okay?
Yeah.
So let me just check in here. Do you think she'll try to bite?
No,
Okay.
no, she never does.
All right, we'll just work. I'll talk less and work more. Okay, that's a good extension. Really pretty dog, don't you think? I can't imagine this dog covered with infection.
She also had like 80% of her coat was missing. You still can see a little spot.
80% of her coat was gone from the mange and stuff, right? And the parvovirus and
from
everything.
Everything. Yeah, it was. You're such a good girl.
Okay, so I'm coming down the back, and this is the bad spot here, and this is, there we go. And I'm now on the lumbars. I'm into the sacral base here. Good. Let's go back to the neck. And I feel something here. Like put your fingertip right there, and there's like a tight muscle there.
Mm-hmm.
So that's something you can massage, but I'm going to also adjust underneath it, and you'll still want to massage that. So we're going to bring her head to the right a little bit. So we're going to bring her head this way. A little more. See, it's stiff that way. So bring your head all the way. There we go. I got it. And that'll make that, or that'll allow that muscle to start loosening up. Let me check your ribs. I'm going to bring your leg back a little bit. That's okay. Let's bring it up. Nice. Okay.
Yeah, last time after the adjustment, even though we came to do it as just as a maintenance, she didn't have any problems at all. But she was just, she's usually energetic and happy, but she was just like, whoa.
So that's good. So, you know, it's good to get a little tune up once in a while.
Yeah.
And she's a very athletic dog, so she probably likes to just have her body feel open and free and good range of motion. She obviously has great nutrition, so she's getting a full holistic approach, right?
She does.
Yeah. And so I'm just working these muscles coming up through the lower back and into the rib cage, reaching around front, feeling the shoulders. Let's bring the shoulder up. Yeah. There we go. Bring this up. Good. I think
you see, that doesn't happen at the vet.
I think we got
she wouldn't take treats or we don't go there often, but last time we went, it took 4 people and like an hour and 15 minutes just to draw blood.
Oh, so she trusts me.
She does, yeah.
I mean, you're side by side with me.
She trusts her vet. I was side by side. She just doesn't, she doesn't do that.
The chiropractor is more fun.
Can you be a vet too? Can you draw blood?
No, I can't. All right, let's put her down, okay?
Okay.
Let's see if she wants to do this thing. Good. So which of the humans wants to go next?
Go, Regina. Yeah.
Yeah?
Okay, do you have anything that's bothering you
my
today?
neck.
Okay. Here comes Critter.
Hard sniffs.
Critter's either saying hello or wondering if you have a treat. Which do you think it is?
I think he's saying hello.
All right. It's part of your treatment today. You get a little critter in the mouth.
In the nose.
In the
Instead
nose.
of the balloon.
Up the nose. Right. We're not doing the balloon today. We're doing a new technique where we put a dog's tongue up your nose and see if we can make your face crack that way. All right. So you actually have a spot here. Is it okay to adjust it today?
Yeah.
All right. Let that go. Let it relax. Wow. So that's good. So you have another one on this side. Should we get it?
Yeah.
Are you up for it?
Uh-huh.
Okay, big breath in and blow it out. Whoa. Big breath in and blow it out. Perfect. We're gonna crisscross your arms like this. Big breath in. Oh, blow it out. Wow. How was that one?
I felt it.
Wow, how was that? Good. Here's another one down low. That's fine. All right, I think you're done. I'm gonna have you come sit up. How do you feel?
It felt awesome. Oh, I can. You see that?
Yeah.
Yeah, it just didn't move a lot.
Yeah, now it's more open.
Yeah.
All right, good.
Thank you.
All right, thank you very much. Right in there. Okay. Lie on your back next. So I'm gonna come under here like this. Get my hand in here. And did you hear that click?
Mm-hmm.
Now try it.
Oh, wow. That's nice.
Got it. Now try it.
Well, yeah.
Good.
Yeah, I just feel like I'm gonna crack
Good.
like all the way home.
So now you're gonna tilt your head to the left.
Okay.
Oof. Wow. And just get that one. Good. So now lie on your back. Big breath in and blow it out. Got it. Good. So come to the other side, huh, guys? And then the shoulders push back, back this way.
Ooh.
Got it. Good. All right. So come sit up. Come stand, move around, see how you feel.
Oh yeah. Oh my gosh. I'm gonna do some yoga when I get home, let me tell you. Thank
Good.
you so much.
Now, if anybody can find a video that has 4 dogs and 2 people getting adjusted in the same video, I'd like to see it, so send me the link. But otherwise, just watch this one because it's the only one out there. There it goes. Woohoo! I just got that one. So you want to get down and shake your little head?
Okay, hold on. You gonna wait until we leave?
It's okay, you don't have to shake.
He says thanks.
Sometimes they don't shake.